We decided as a group to focus our presentation around the role of cultural geography in a changing world, with particular reference to globalisation. We are drawing from our key interview reading, When Cultures of Care Meet, Entanglements and Accountabilities at the Intersection of Animal Research and Patient Involvement in the UK, by Richard Gorman and Gail Davies, as well as using wider reading. We argue that the main role of human geography in a changing world is to identify patterns and relationships between different disciplines. Certain aspects of issues can often be at the margins of various disciplines, but the interdisciplinary insight within human geography can help prompt change by shedding light on these issues. With a particular focus on globalisation and the COVID-19 pandemic, our response to the overall question is broken into two main points: the role of culture in a changing world and its relationship to the culture of care, and the role and distribution of power within the culture of care.
What is the role of culture in a changing world? I will discuss the link between globalisation and cultures of care and the effect globalisation has had on healthcare. Globalisation refers to the increasing interconnectivity of the world. This causes increased cultural awareness and responsibility. People feel more connected with their surroundings and are aware of the impact they can have on animal and human care, both in the UK and on a global scale. Gorman and Davies express the significance of culture within healthcare and the impact poor care can have. The inadequate care provided by the Mid Staffordshire Trust in the late 2000s was a result of poor cultures within the institution. Business objectives were prioritised over the standard of care provided to the patients, which caused an increase in mortalities. This clearly shows the role cultures play within the wider context and the relationship between cultures of care and globalisation. As well as this, cultural changes need to be incorporated alongside structural changes in order to achieve efficient and effective healthcare. The misconduct which occurred at Huntington Life Sciences shows that cultures within institutions need to be improved in order to achieve global social well-being. Cultures of care require strong relationships. Globalisation has allowed for these relationships to be built across the globe, which has resulted in increased collaboration. The role of culture in human geography, therefore, is to shine light on key issues within the healthcare sector in order to achieve sustainable global health.
In this slide, I will be assessing the relationship between globalisation and cultures of care. Globalisation has had a significant impact on healthcare and has both posed challenges and helped raise awareness of issues. A significant example of a failure in cultures of care can be seen in the Mid Stafford Hospital, where there was a large scandal following a number of examples of poor cultures of care and unnecessary deaths. The subsequent Francis report found that quality of care was reduced due to cost-cutting measures, and this sparked a national uproar. Cultures of care have also been affected by the coronavirus pandemic due to increased strain on healthcare and issues with allocation and scarcity of resources. It's caused a lack of hospital beds, forced nurses and doctors to have longer shifts, and to wear protective equipment, which all have had a negative impact on cultures of care. However, globalisation can also have a positive impact on cultures of care. For example, 13.8% of NHS workers are foreign, equaling around 170,000 people. This is a clear consequence of globalisation and links to ideas of a shrinking world. It also illustrates the reliance of the NHS on foreign workers. Without these key workers, there would likely be far increased issues with healthcare and a far greater strain on the NHS. Overall, there's a clear link between globalisation and cultures of care, and how it can provide either a positive or negative impact on cultures of care.
In the next few slides, we'll be talking about how power plays a role within cultures of care in a changing world. In a world which has been and continues to be shaped by globalisation, geographers play a key role in acknowledging the way power is distributed within and between institutions as well as across space. An increase in patient public involvement in health research has resulted in cultural geographers identifying the importance of acknowledging how power is distributed. In the key reading, Davies and Gorman note that how far culture is able to achieve gains in patient care requires understanding the distribution of power within an institution and how other cultural norms have come to marginalise the work of care. They then go on to put forward that an effective culture of care is expected to permeate an institution, with all being equal participants in the co-creation of shared values and outcomes. In a healthcare setting, adopting an egalitarian approach is vital to prevent pressure being placed on certain staff members and power being distributed in uneven ways. Doreen Massey, a cultural geographer, devised the concept of power geometry, which refers to the highly uneven ways in which spatial modalities of power are differentially engaged such that different actors in different places have different degrees of freedom. Massey's power geometry highlights how power varies greatly both between and within places. This is particularly visible within healthcare. The importance of acknowledging how and where power is held within institutions is vital for adopting good cultures of care, and it is the role of the human geographer to highlight the varying power geometries in order to bring about equality.
Looking at power on a more global scale in relation to cultures of care and COVID-19. We have highlighted how important the understanding of power distribution is when it comes to the effectiveness of cultures of care in the last slide. But when looking at power globally, we can't ignore how there has been a crisis mode triggered by the spread of COVID-19, which in turn has caused a notable shift in the distribution of power in our changing world. Suddenly, the cultures of care have become far more collaborative, as people are working together and putting large amounts of money into COVID research globally. Though COVID has seen collaboration between people in the research to find the vaccine, issues of vaccine nationalism show another side and have highlighted a shift in power dynamics. One doctor presented the problem that countries scrambling to be the first to vaccinate their populations will achieve little if others go unvaccinated as a result. The distribution of vaccinations can be linked with geopolitics and can arguably be looked at now as further evidence towards there being clear winners and losers of globalisation in our changing world, which as human geographers we look to raise awareness of. The World Health Organization officials have voiced concerns at vaccine nationalism, which they believe now could even increase the risk of coronavirus mutating further, after a week-long row over shortfalls in EU supplies of COVID-19 vaccines. In our interview, Gail Davies said she thought there had been questionable decisions with how the politics and economics around the vaccine had been handled, going on to say that she felt it could be creating a divide. It is not recognising this divide that will prevent us in achieving equality within our healthcare worldwide.
Our first point highlighted the role of culture in a changing world and its relationship to the culture of care. Globalisation brings greater cultural awareness and increases the breadth and depth of connections. This is demonstrated through people becoming more aware of their impacts on human and animal care, something Gorman and Davies' reading highlighted as being highly significant, as good cultures of care are key. The Mid Staffordshire Trust and Huntingdon Life Sciences case studies noted how when cultures of care are poor, there are significant impacts on human and animal health and well-being. This in turn highlights how cultural and structural changes are required in order to achieve efficient and effective healthcare, which has both strong foundations and good connections. As globalisation has brought awareness to these issues, changes have been made, for example, an increase in the provision of healthcare staff. Although other issues remain, for example, resource scarcity, as healthcare demands are increasing. Overall, this demonstrates that the role of culture within human geography is to find issues within the healthcare sector, which then allow for changes to occur, overall creating sustainable global health. Our second point highlighted the role and distribution of power in a changing world within cultures of care. This point argued that noting power distribution is of great importance. References were then made to power geometry, a concept formed by Doreen Massey, as observing power distribution highlights inequalities. This can be seen in particular within the healthcare sector. Within our point, we also made reference to the COVID-19 pandemic and how this has altered cultures of care and power dynamics, making cultures of care more collaborative, something which can be seen as a positive. However, vaccine nationalism has altered power dynamics, which in turn possesses threats to both the spread of the virus and creating and maintaining equality within the healthcare sector. On the whole, it is the role of geographers to note these inequalities in order to create good cultures of care. Overall, it cannot be denied that cultural geography plays a key role within a changing world, with geographers in particular highlighting inequalities in order for changes to be made to ensure a sustainable and equal world for all.